Hi everybody, this is Dr. Stauber. Today I want to talk about something called intrauterine constraint. Now, intrauterine constraint refers to tension or external forces that are being put on in the pelvis and the sacrum, and that's creating tension within the uterus and pulling and tugging it, the ligaments and muscles around the pelvis. So when that happens, that tension essentially decreases the space for your baby to be able to turn when they should turn around the 32nd week of pregnancy. There is a very specific technique called the Webster Certified Maneuver or Adjustment Technique that is learned by doctors of chiropractic who take extra training or postgraduate work in obstetrics and pediatrics. And the idea behind this technique is to make corrections or adjustments to the pelvis, the sacrum, the muscles and ligaments around there to relax that tension, take the tension out of those ligaments to reduce the restraints in the uterus. This technique is really a safe and very conservative approach for babies that are breech. And again, this is not a baby turning technique, but rather an approach to attempt to reduce tension in the pelvis and allow the body to naturally take it where it needs to go and allow the baby to have that space in there. This technique is definitely best done the earlier the better. So if it's at the 30th week, once you start hitting around the 35, 36 week period, the success rate really drops just because there's not a whole lot of room left for the baby in there to turn. So if done early enough, the success rate is up over 80%. And there was a great study done on that. You can research that on JMPT. But if you have questions about your pregnancy or concerns about pain in the pelvis, breech babies, please don't hesitate to reach out. I know it's a very difficult time. Being pregnant can be a wonderful thing, but it can also be a very painful thing if your body's not lined up properly and the pelvis is not moving and adapting the way it should or could anyway. So please don't hesitate to reach out at 705-984-9077. I should also note that it's also important to talk to your doctor about if you do have a smaller uterus, if there's other things that are going on that might be causing your baby to be breech, and by all means, it's really important to get those things checked out. Okay, so I hope this helps and sheds some light on that, but know that there are some really great safe options out there for you. Thanks a lot.